So today we are taking a topic, evidence-based decision making. Okay, this particular topic is very important, especially if you are a postgraduate student. Okay, for PG, this particular topic really helps you a lot because being a postgraduate student, you have to go through a lot of articles in your PG, especially if you are conducting a systematic review. Now these days it is actually mandatory for your LD, for your thesis also you'll have to go through a lot of articles. Now in order to find out the right article or whether an article is relevant or legit, you need to know or be able to critically appraise it. Okay, so for that particular thing or that particular expertise, you need to know how to find out whether an article is fake or whether the study was actually conducted or how relevant it is to you. Okay, so we'll go through it. Okay, now these notes I have made from Carranza. For better clarification, I would really suggest you go through the book properly, read through the book, then watch this video. That would be very, very helpful to you. But again, if you don't have time and your exams are really, really close, then it's okay. You can just watch this video and this will really help you too. Okay, so first of all, evidence-based decision making, what is it? So it is basically what the name suggests. We make decisions based on the evidences. Okay, right? Like, for example, if you want to find out whether a particular procedure, let's take it coronally advanced flap, okay, versus Vista. You all know Vista. I hope you all know Vista. Perio people would, but someone non-perio as in BDS student might not. So this is vestibular incision, subperiosteal tunnel access. It's a technique used to cover root. Okay, so basically a root coverage technique. Okay, and coronally advanced flap is also a root coverage technique. So we want to find out which one of them is better. So what will we do? We will go online, we'll look for articles, okay, relevant articles. And basically the best ones to help us out with this particular decision making are systematic reviews or meta-analysis. So they will tell us which one of them is better. Now in order to actually, make a decision, you need to know even the systematic review which was conducted is of high quality or not. To find out high quality evidence and to actually use that evidence in your practice, you need to know and learn this particular process. So this is the mind map that I'm gonna be now referring to. Okay, so this was first basically practiced, or you can say discovered or used in McMaster University, Ontario, 1980s. Okay, moving on to the aspects of evidence-based decision making. So aspects basically include methods of generating what? High quality RCTs, then statistical tools, that is synthesizing and analyzing systematic reviews and meta-analysis, and ways of assessing evidence and applying it. See, there's no point assessing anything if you're not able to apply it further. Okay, now all of these obviously help you in effectively implementing it in your clinical practice. How can you do that? Now in order to go for evidence-based decision making, you need to have an effective way, that is online searching skills of relevant information. You should be good with tech. You should know your way out, the search bases, search sites, search engines. Okay, then you should have critical appraisal skills. These can be developed. Even if you don't have them, you can develop them. Skills are something that some people are born with and some people develop over a period of time. So even if you don't have, that's okay. You can develop it at any point of time. Now coming to principles. Two principles that are main over here. First is skills and abilities needed. What skills are we talking about here? So basically, whenever you are looking for an answer, you should have a good question, right? So for that question, you need to have a problem. Okay, so here you need information, or basically the information that you need or looking for, or particular problem, the solution that you're looking for. Now you convert it into a clinical question. Okay, after converting it to a clinical question, you conduct a computerized search. Okay, After conducting a computerized search, you go for critical appraisal. Now you have your search, you conducted a search, you have certain results. Now in those results, which one is more relevant to your particular solution, your particular question, your particular problem? For that, you need to be able to critically appraise all of those results, okay, and sift out the one which suits you the most or your particular situation. Okay, then critically appraise what? The evidence for the validity or usefulness. Again, validity to what? To your clinical case. Usefulness to what? To your clinical problem. And then finally apply it to your clinical practice and then evaluate. Evaluation is also very important. It's not necessary that if something worked for a particular clinician might work for you too. Okay, the case could be different, the situation could be different. So of course you'll have to be very, very careful here, meticulous while working things out. Now moving on next. So yeah, second principle is basically here evidence alone is not sufficient. Okay, it's not like you have the evidence and you go ahead and make the clinical decision. No, this should not be done. So what is basically more important here is hierarchy of what? Quality and applicability. That particular evidence should also have high quality. Okay, for example, if an RCT is conducted with 20 subjects, as in like 20 subjects per group, 40 in total, and the other one with 10. So obviously the one with 20, that is 40 in total, is better than the 10 one or 21, because more the people, more the number of people, more applicability, more generalizability. Okay, hence you need to find out. And also in an RCT there are certain guidelines, okay, as in like there are consort guidelines which will help you to find out how legit this RCT is, if they have followed the norms, if they have followed the processes which require to generate a high quality RCT. So once you know that the quality of your RCT is good, then you can go ahead and make a clinical decision. So what do you need? You need hierarchy of quality and applicability and evidence which should exist and guide you to make a clinical decision. Okay, so what are we saying? That evidence alone is not sufficient. That evidence should be of good quality and plus applicability to your particular situation. Now moving on to processes and skills. So process and skills basically involve asking a good question. Again, if you need good answer, you need to ask good questions. Now here what comes in picture is the PICO criteria. Many of you who must have conducted a systematic review or made a protocol for a systematic review would be very, very familiar with PICO. So what is PICO criteria? So here P stands for patient, I stands for intervention, C for comparison, and O for outcomes. So basically you convert your clinical situation, your clinical question into a PICO criteria. Okay, then what do? Then you go ahead and conduct searches. So before moving on to that, I would like to actually throw some light on what PICO helps you with. So PICO basically forces a clinician to focus on the most important issue and outcome. So most important issue is basically your either could be your intervention, okay, or a particular demography of a patient, right? Or if you're going for comparison between, like for example, we saw coronally advanced FAP and VISTA, on the outcome. So the outcome, again, what are we looking for? We are looking for either success rate, failure rate, or is it a superior or inferior type, like which one is more inferior, which one is more superior, right? Then it also facilitates in helping a clinician to take the next step, that is you're conducting a computerized research. Here you need you need keywords. Okay, keywords help you in getting more relevant search results. Then it directs the clinician in identifying clearly the problem, the result, and outcomes which are related to a specific care. Okay, now this is what this was about PICO here. Moving on to competent consumer. So this is also very important. Of course, I mean, competent consumer, we all know, whenever you go out to buy something, like for example, if you're buying a chair also, you'll check it out properly. You'll sit on it, you'll check the material, you'll check the price, okay. You'll check the manufacturer details. You'll go through a lot of things before consuming the chair, before buying the chair. Same goes for n number of other things. You're going out to buy clothes, shoes, etc. Now, applying the same principles here, the studies also, you have to make sure that when you are referring to a study or you are citing a study, basically doing anything with the study, you should be competent about it. Okay, competent how? You should make sure that the study is not of weak quality, is not limited to certain things, and it's not poorly conducted. Okay, poorly conducted as in like, for example, if it's a randomized clinical trial, many times you notice that they have not even randomized. Like, name itself says randomized clinical trial, but randomization itself is not done properly. So this happens, you develop this kind of thing, this knack after going through a lot of studies. It helps you in critically analyzing and appraising. Okay, now your sources for studies could be primary, that is your original researches such as RCTs, cohort studies, etc. So these are primary sources. Then you have secondary sources. Secondary sources are synthesized, that is from already conducted studies, could be systematic reviews or clinical practice guidelines. So we all know systematic reviews, basically what do they do? For a particular topic or for a particular clinical question, could be clinical, no, could be non-clinical, what they do is they compile all the data that is available in the scientific databases. That is, could be your RCTs, could be your RCTs, could be your observational studies, okay, could be your cohort studies, okay, could be in vitro studies also, depending on the topic. So what do? They compile all of them, okay, and they find out the best quality evidence out of them, and then they formulate whether a particular, for example, we saw clinically coronally advanced flap versus vista. Okay, so what am I going to do if I want to find out which one is better? I'll check out for all the possible RCTs who have compared these two techniques, and from those I'll try to extract the success rate of both of them. So whichever of them have a good success rate, or the clinician, as in like in those particular RCTs, have shown superiority, of course is better than the other one, right? So this is what a systematic review is about. So one systematic review can easily tell us whether I should go for a certain procedure or not. For example, if I want to place implant and I want to know whether immediate implant are better or delayed implant are better, so I can easily just go find out, go for a systematic review, which is comparing both the techniques and see what the success rate is or failure rate is, right? So this is what your systematic reviews help in. Now, systematic reviews also, basically the next hierarchy, the topmost hierarchy, consists of clinical practice guidelines. So after compiling all the systematic reviews, and from all the systematic reviews and RCTs, certain clinical practice guidelines are made, which are basically your gold standard. Now, moving on to your levels of evidence. So levels of evidence is very important, because this if your evidence-based decision making is absolutely incomplete if you don't know the levels of evidence. So we have been studying from BDS itself about levels of evidence, where the topmost now is CPG, that is your clinical practice guidelines. So these are systematically developed statements which assist clinicians and patients to get appropriate health and benefits in specific clinical circumstances. Okay, so here with clinical practice guidelines, you don't really have to think a lot. You just go for the guidelines, you find out, and you practice. Then your systematic reviews. Systematic reviews, of course, it depends on the qualities of studies included. If high quality studies are included, then of course your systematic review automatically becomes a high quality systematic review. Then your RCTs. RCTs basically are the second number. These come sort of in first number only, then your RCTs. Then you have your cohort studies, your case control studies, and then lowest order comprise of your case reports and animal or lab studies. Now, searching we know, of course, we have databases such as PubMed, Scopus, Web of Science. Okay, once you've formulated a PICO question, you can go ahead and put it in the search box. Google Scholar is also pretty good, and go for the results. Now, once you have the results, there are certain checklists or guidelines in place, such as Consort for RCTs and Prisma for systematic reviews. Then there are critical appraisal skills programs also available, which you can easily go online and learn, which will help you identify and apply, evaluate the outcomes in real world clinical evidences. So coming to critical thinking, there are 12 tools which are available and which are mentioned in Carranza. Okay, I'm not gonna go through all of them, but I would really suggest that you go ahead and open Carranza and go through all these critical appraisal tools, because again, these are very good. Reading through them was very funny. Carranza has written it pretty wittingly. So yeah, please go ahead and study. So this was all for today. Thank you. If you have any questions, you can post them. I'll try to answer them as much as possible. And any other particular topic that you want me to cover, I'll cover if you just post them in the comments. Thank you.